thank you so much for the incredible work you do with your staff to help the youth today and all the time, really. This has been one heck of a year, and it's almost unbearable, really, for so many families. So why don't you explain to us how this pandemic is impacting the youth today?
Yeah, and thank you, Elisa, for being here tonight for this event. Yeah, it's great. For the event, for supporting this cause of youth mental health and this conversation. I'm so appreciative of you being here and giving your
Always.
time. Yeah, we definitely have seen an impact in a really significant way with young people. And to understand that impact and what that growth has really looked like, it's important for us to understand in context what we've been seeing really over the past decade with young people, which has been this spiking in mental health issues. So going into the pandemic already, there was a lot of knowledge that we had in terms of seeing the number of kids seeking help and the acuity already being high. There are some data points that we always like to refer to, and one of them is the Healthy Youth Survey data, and it's something that students do in schools. And they self-report every couple of years, and this data reflects all the markers for mental health were already up going into the pandemic. So those things that tie to stress, anxiety, depression, and suicidality, they're already sitting there. In fact, there's another marker out of it that 22% of high school seniors have had suicidal thoughts. So we went into the pandemic already with this mental health crisis of young people and the mental health system overall not having the capacity. The exact issue that you talked about having with your son is a really common experience. There's not enough resources in the mental health system for children and youth right
I
now.
couldn't believe it. I was calling everywhere and there was no help. Why is that?
There's a lack of resources. There's a lack of resources, and there's just this incredible need that's out there in terms of some of the causal factors. There's trauma is one of the top factors that kids report. Social isolation, even pre-pandemic, they were reporting that. There's a lot of kind of political and social factors that actually that kids have started reporting, more, and academic pressure to succeed in school and to kind of build their resumes to go on to college and like have this perfect life that they're told that they're supposed to have. Those things have all really played a role in a rise that we've, seen. And
And then the pandemic. That just compounds everything, right?
and
The
then
isolation.
yeah, and then the pandemic. Yeah, and yes, absolutely there's the isolation. And there was all this loss of the routine and the structure with school and being in person with other adults outside the family. So teachers, coaches, the teacher in charge of the drama program. There's a lot of supports the kids have that we take for granted and didn't really realize when this all happened. Those protective factors of having these other relationships was gone. And also being involved in something that you're really good at and enjoy is also really part of positive psychology. And they just didn't have those opportunities to do that. And there's just a lot of general grief and loss around those things and other things. So we've had young people that have lost family members. They've died during this time and they didn't have a proper goodbye. To kids having some of their really good friends move away and they didn't have proper goodbyes. There's high school graduations that have happened and not really happened. So there's been all these things that will just never come back, and there's a lot of grief and loss that really creates this foundation. And what we see from that is this just really, profound level of anxiety and depression. So what I was talking, about earlier with that, it's spiked. So in pandemic, we already had this going in. We didn't have enough resources in our system overall to respond to the needs. And now with a pandemic, it's even greater.
What should we be watching for as a parent if we're thinking about this and we're thinking, oh, maybe that's not my kid, maybe that's the neighbor kid?
Yeah, I think it's really important to never believe that it's not your kid, because we know that a lot of kids that we have seen that we've lost in the community are kids that actually on the outside look okay. And I really want to emphasize that because we have kids that do okay in school, they're in an extracurricular activity, and they have a social network of friends, and we've lost them to suicide. So what's going on with the kid, it's not as obvious as to what maybe people think. There are certain kids that will show factors that are really obvious. They may be either sleeping too much, they're not sleeping, their eating habits change. There's things that you can watch for, and you can hit online and you can find those 7 to 10 reasons. But the reality is we just really don't know because on the outside, kids don't show it in the way that we expect them to.
You talked about how many kids are having suicidal thoughts. Are we really seeing an increase in suicide?
We are. Sadly, we are. And again, I just like to ground things going into the pandemic, already. It was the second leading cause of death in Washington State for young people between the ages of 10 and 24.
How much of that is anxiety? How much of that is drug use? How much of that is depression? What do we know? What are the contributing factors? Or
those factors all contribute to it. There are some separate statistics that during 2020 there was a 23% increase in overdose rates. Not all of those are youth, but the majority of those overdoses actually were ages 18 and lower. So
were some of those overdoses considered suicides?
yes, but not all of them were necessarily, but they were self-medicating, right? They were self-medicating mental health issues.
Sure.
And I mean, there was a month that there was 2 deaths that I knew through friends, and that really made a mark on me. I just knew more of the story around it. It's always tragic, but it was really just this deeper hit. And I also then got the information that we were keeping in terms of what the county's telling us of what's happening, how many kids we've lost, and it all was in this month, right? And it was just profound, the number of young people that we were losing to COVID, or not to COVID, during the COVID response.
Right. So when you think of people that are self-medicating, you almost make that sound like it's suicidal because it's wanting to disappear.
It's a very, very high-risk behavior. It's trying to calm the mental health issues. So you said your son had ADD. Well, that's something people will self-medicate for, right? Or self-medicate depression, self-medicate the anxiety, trying to quiet those things.
Well, I lost a father to suicide, but he started using heroin, and we didn't even know he was this successful businessman. Everybody thought he had, everything going for him.
Yeah.
So I know what it's like for it to look one way on the outside and to be something else going on the inside. How much of a financial hit has your organization taken during this pandemic?
I want to give a big thanks to our donor community and supporters because it's been really heartening. 2020 was a time where people they stretched gifts often during that time, and there were COVID relief grants. And it was really was heartwarming to see what happened, not just for us at YES, but as a community as a whole for the not-for-profit sector. This year is different. We're not in the midst of the most obvious parts of the pandemic, and there's this sense of recovery, but it hasn't really changed our financial picture. So we need folks to be doing the same thing that we did last year because, like I said, some of those COVID grants just are not there in the same way this year. And we've taken this additional hit because the way that organizations like YES and we get reimbursed for Medicaid has actually been decreased greatly in the way that they've changed reimbursement. And this is a big hit because Medicaid funds our lowest income families, and during this time, a lot more families have lost their private insurance, families have lost jobs, so more families have moved to Medicaid coverage. And Medicaid coverage already was not commensurate with what actually really costs to do treatment. Treatment is expensive, behavioral treatment for youth. You have weekly therapy often, group therapy, psychiatry. It is not a cheap undertaking to do this work. To do it right, it requires a lot of resources, particularly really on the front end. And that change has actually hit across the child and youth sector. So organizations like us are seeing between 15 to a 35% reduction in Medicaid reimbursement amount overall, which is huge. It's huge. And what's happening?
It's devastating.
It's devastating. And I will tell you that organizations financially through all of this have held back on staffing. So if there's been any folks leaving through attrition, people haven't had the money necessarily to restaff. So at a time while the acuity level is extremely high and there's a lot more kids we're seeing that are suicidal, there's a lot more kids with needs right now, the actual system has less money coming into it. So it's really a big, profound miss. And I know nobody intended for that to be the outcome, but it is where we're at.
So then how stressed is staff? Because the staff is working, and I don't mean to put your staff on the spot, but think about people who are helping people who feel the anxiety because they're empathetic, and now you have fewer people being able to help people, and they feel their pain.
This is a really challenging time to be doing direct work with kids. I mean, we all care about the young people that we work with as clinicians, and it definitely adds this entire additional layer. It's always been a complicated and challenged system to work within, but it's become more pronounced in the way that there's kind of a framework and a model. And it just kind of is a miss, actually, for children and youth. It doesn't match the way that children and youth engage and their families engage in treatment. And let's be real. I mean, do families just show up every week exactly how they're supposed to and just kind of dot all the I's? No families do that. I mean, I've raised 2 kids. Life is chaotic as a family, and our Medicaid families have a lot of other huge life stressors against them that some of the rest of us don't even have, right? So it's significant, and it is really part of, really what we're talking about here tonight. Our community came together last year and really, really brought success for us through last year, and we want to make sure people know this isn't over, and that financial need, it's there.
How much do you think it impacts people not going and getting help because they worry about how much it costs?
Oh, I think that happens all the time. Because again, the intervention with mental health, unlike a doctor's appointment, you've got a physical or you have some ailment that you go and you get a fix, and you don't go to the doctor that often physically unless you have some really serious health problem, right? But with mental health, the intervention is a lot. So
But like dad's laid off at the restaurant, and
Yeah.
he's like, okay, I can't do this, but my kid is depressed and I want to help you, but I don't know if what am I going to do about insurance and so on.
Yes, it's huge and it's a barrier. So there's a few barriers. Stigma, one, that folks don't want to admit they have mental health. And that's something we need to really do away with and have regular conversations about mental health. But one of the things that we're really proud of at YES is we turn nobody away regardless of ability to pay. And again, the Medicaid funding never met the actual true cost of care for us. And that's why we've always had a really strong private fundraising to help offset what that is. And it's even greater now. And you'll see in the video later of our client, Hari, that demonstrates, people need to know that they can access that help. It's a major, major barrier for them to not know that they can afford that.
You put on a strong front in front of everybody here, but what was the toughest moment for you this year?
Well, I'll say, admittedly, being a leader of an organization amidst all of this and knowing that we had this lessening of resources and trying to figure out how we got outreach to kids during this time and how did we, work our pivoting from in-person services to telehealth at the beginning, and then moving from that to figuring out how we do the hybrid services, like just this continual way of working to optimally engage kids. That was a real stress point. And then personally, this has been really hard. Having structure and consistency in our lives is really important for our mental wellness, right? Mm-hmm. And for kids, it's incredibly important, right? And that's one of the things. The protective factors are not there in the same way, right, that we were referencing earlier. They just had that structure was gone and the like. And I think that, for me, working towards my mental wellness and showing up every day, mm-hmm. Let's do away with the mental health stigma. I had more mental health challenges in this last year than I've suffered in 20 years. Right? And I think that's just real. That's what we've all really been through. And we know that that's what's going on with our kids. And I think that's important for us to recognize. Because did you have challenges during this year?
I had breast cancer this year.
Oh, yes. I'm so sorry.
I just finished radiation. I'm here. So talk about having some mental health challenges,
Yeah.
It's not been a good year.
Yeah, I'm sorry for that. I'm a cancer.
But I'm here. I'm here to be with you.
Yeah. I'm a cancer survivor myself from many years ago. I can't imagine going through it during COVID. But, I think that wellness and taking care of ourselves is so important and working to be present for the young people that are in our lives. And I really want to emphasize that because I think a lot of people think that they have to all have expertise to be kind of checking in with kids, and it really is a community effort. And parents are really stressed. Parents have lost a lot of their supports. They have been the teachers. They've been trying to be a therapist to their kids, and people don't have grounding and think they got to get this all perfect. And the reality is we need to just stop, slow down, and be intentional and check in with kids and make sure that they're doing okay and have conversations. And that can be a really awkward and unusual thing because in our culture, we have a lot of stigma around mental health, right? Which is just ridiculous because everybody has mental health. We all have it where it is shown in a way, or we feel it in a way that's more positive. And then there's times where life is hard, right? It's just a normal part. And we need to have these intentional, compassionate, engaged conversations with young people. And I know that, okay, even with my own kids, and can I just sit down and start having a conversation? Are they just always going to do that? Well, no, they're not. But you can do things like take it off in a bite size. So say, hey, you know what? I just want to check in and see how you're doing emotionally. And again, they may think that sounds really dumb to them, but they will appreciate it. And you can say, you know what, I just want to check in with you for 3 minutes, and then I'll let you be. Or you could have a conversation by text where you're not having to talk face to face.
Oh, well, they like that, don't you?
Yeah, well,
You can be sitting right there and do that conversation.
Yeah, I mean, technology has had, it is a presenting issue of a challenge for kids in terms of their mental health. But there are ways to use technology that actually can help us communicate, right? So if you can't have an in-person conversation because it feels so uncomfortable and weird, then do it by text.
One of the things when I was talking about my son's situation before, because he worked through his situation and is doing so well, he has gone on to help other kids and has noticed when they were depressed and has talked to them, do you have ADD? Do you have depression? And has suggested when they should get help because he's made it this so that it's not taboo. And that can be contagious in a good way.
Yeah.
And I think that's a great thing. Like you say, let's have the conversations.
Yeah, there's a program called Teen Mental Health, and we actually did a pilot project of it, and it literally ended the day that the schools closed for the pandemic. And that's what the focus of it is. And during the pandemic, they have not continued this program, and it's a national program, but we hope to continue to do that work because, as we know, peers, young people talk to their peers, right? We don't turn to our parents always and ask. Our parents care about us, but we sometimes feel embarrassed. Like if we're being bullied, do we want to say something to our parents about it? Like there's this barrier that can exist. And that's why I just really say it is the whole community's responsibility, whether we're teachers, whether we're coaches, the neighbor, whoever, like we all have an obligation to check in with kids. And again, it doesn't have to be a big conversation.
Yeah.
But it makes a difference. I mean, again, like I think back to my own life and the challenges I went through in my growing up and the challenges. I love my family, but we had a lot of challenges in growing up. And my family it was a lot of rough things. And there was a lot of people that helped me throughout that time, and I can call up who those people are. And we know that actually there's stats that show kids that are able to connect with people in that way, it really helps their mental wellness. So as a community, everybody coming together and realizing this is a collective. And I know people will feel afraid. Okay, I don't know what to do. I'm not a therapist. Right, okay, I get it. I am. I've been trained, doing this work in some way for 30 years. But it doesn't take an expert to do it. A caring conversation that's compassionate, open, and real. And if it exceeds what your abilities are to do, knowing where to send kids to broker to them that help is really an important thing, to do. And if you feel really, really not good about your skills, there's lots of opportunities to get education. And right now there's been a lot of online opportunities around child and youth mental health. And we've done them. We have partner agencies that have done them. We've done them together with other partner agencies. There's been a lot of collective work in that way. You can go online and do a youth mental health first aid class. Though it says youth mental health first aid, so that gets a little bit, people think it's something different, but it's actually meant for adults to learn about youth mental health. So there's ways to build skills and a lot of importance around the intentionality of checking in with kids.
But what you've said tonight is going to help other people realize that they can make a difference by making a donation. That's going to make all, and by having a conversation.
Having a conversation, it does take resources. This event tonight is about the community coming together in the same way that they did last year.
And they're going to come together. I know they are.
Yeah.
You got them going. You've inspired them, David. Thank you so much. Thank
Yeah.
you for just sharing how important these issues are and what we can all do to help.